Dry eye can be influenced by so many things. Dry indoor air, windy climates, certain medications, hormonal changes, aging, whether we like it or not, the fact that we're staring at computers all day. But today we're going to focus on two foundational pieces, your tear film and your eyelids. And I'll share 3 treatments that you could begin at home today. And don't worry, I won't save them to the very end. Hi, I'm Dr. C, double board certified optometrist and the owner of Eye Drop Shop. On this channel, I'll break down complex dry eye problems, review products honestly, and share all the newest, latest, greatest evidence-based treatments available. My goal is simple, to empower you with knowledge so that you can get the solutions you need. In clinic, my patients are always telling me, I really wish I knew about this treatment sooner, or I didn't even realize dry eye was an actual condition. So here I am on YouTube with the main goal to empower you with knowledge so that you could seek the help you need, ask the right questions, and find concrete solutions. I actually also happen to suffer from dry eye myself, so I truly understand the frustration, the ups and downs, and the need to find something that works quickly. Before we go on, please like and subscribe and ring that bell so you don't miss any other videos. Now, before we talk treatment, we need to understand what's happening on the surface of your eye. So let's dive right in. Your eyes are protected by 2 key players, the tear film and your eyelids. So let's start with the tear film. Think of this as a thin, delicate coating with 3 layers that work together, honestly like the perfect team. So we have the innermost layer that's called the mucin layer, and this is like a primer coat, so your tears can spread evenly across the eye. The middle layer is called the aqueous layer, and this is the one that provides all the good stuff, the moisture, nutrients, and oxygen to keep the surface healthy. And the outermost layer is the lipid layer. And this comes from these teeny tiny tubes in your eyelids that secrete oil. And the goal is to keep the tears on the eye and prevent them from evaporating. Now, if any of these things go off balance, that's when you start to feel that dry, burning, or watery eyes. Let's move on to your eyelids. Your eyelids are more than just kind of curtains that open and close. Inside, there's these tiny oil factories called meibomian glands. I want you to imagine that each gland is like a spring. So every time you blink, you're compressing the spring so that when you open your eyes, the oil will kind of shoot out, go on the front part of your eye, and coat the surface of the eye. Now that's inside the eyelids. Along the lash line, there's these little pockets, and they can collect things like bacteria, flakiness, and even mites. I know it sounds gross, but we could fix this and it's fine. So when any part of the system is off, the tear layer, the oil glands, the lashes, all of that, that's when you start to feel your symptoms. And so that's why the treatments we're about to cover really focus on restoring that balance to both the tear film and the eyelids. So the moment you've all been waiting for, let's talk solutions. Solution number 1, choosing the right eye drop. Most people reach for artificial tears when their eyes feel dry, gritty, or irritated, and it's completely normal to go there as our first step. But the common misconception is it's just water to help lubricate the eye. But a good artificial tear is actually going to help rebuild the tears you have. So the key is we want to try finding the underlying root cause of why you have dry eye and then match that to the drop. For example, let's say that outermost layer isn't working as it should. So your tears are going to evaporate too quickly, and we want an eye drop that contains lipids inside. So we could fortify that layer and kind of fake your eye into thinking it's working properly. Then in the background, you could be doing some in-office treatments with your doctor. On the other hand, if the water layer isn't optimal, then we're looking at eye drops that are rich in hyaluronic acid or other polymers. Because hyaluronic acid acts like a microscopic super sponge. It's able to hold up to 1,000 times its weight in water, so you can imagine the hydration that gives. Now, pro tip, after instilling a drop, I want you to close your eyes gently for 20 to 30 seconds without squeezing or anything. You could even press on the inner corners, and that'll help the tears stay on the eye longer. You could kind of think of this as watering a plant. You don't want to pour the plant over right away. You want to let it seep into the soil, and that's what we're trying to do when we put eye drops into our eyes. Now, if you're reaching for drops more than 4 times a day and you're still feeling uncomfortable, it's definitely time to see an eye care professional because we want to know what's really going on and treat that underlying issue. There's in-office treatments like IPL or radiofrequency, for example, that might be able to help, or there's even prescription drops that you could get at the pharmacy like cyclosporin or lifitegrast. Finding the root cause really will reduce your dependence on over-the-counter drops and help you find lasting relief that'll help faster. Solution number 2, heat therapy and blinking exercises. Blinking exercises? Did I hear her right? What is this woman talking about? Or at least that's what I'd be asking if I was watching this video. But stick with me, I promise it'll make sense. So, remember those glands we were talking about a little earlier, the ones called meibomian glands? Well, the ones we were thinking of as springs. When we close our eyes and we're contracting the spring, we really want to keep it there so that after we open, the oil gets removed. Now, if the oil is hard, there's no amount of blinking that's going to allow the oil to come out. So that's where the heat therapy comes in. You have to imagine it's like butter in the fridge or warming up the butter in the microwave. We want microwave butter, okay? So to do this, we ideally want to heat the eyelids to a temperature of 42 degrees for 10 minutes. So here's the ideal routine. First step, you want to heat your eyelid glands with a reusable heating mask for 10 minutes. The most common question I get is, well, can't I just use a face cloth? And of course you can, but it loses its heat after about 30 seconds. So you'd have to keep putting it under the heat and then doing it and keep putting it under the heat and put it on your eyes. So that's why we recommend these heat masks that you either microwave or are USB chargeable so that you don't have to keep going back and forth. Now, blinking exercises. We want to do this immediately after we've heated the eye because the oil is actually liquidy, which is what we want. So here's the ideal order. First, we want to warm the eyelids with a warm compress for 10 minutes and hit that 42 degrees Celsius. Then we follow it by blinking exercises because the oil is perfect now, it's melted. And so now is when we want to get it out of these little oil tubes and onto our eyes. So here's how to do it. Step one, I want you to close your eyes, squeeze gently, and then open. You don't have to kind of squeeze like this and go really hard. Just a light squeeze with your eyelids will really get the oil flowing. The only little asterisk I have is for patients who have ocular rosacea, because in some cases the heat can actually flare up the rosacea, and in that case we have to be mindful. Now, none of these treatments should make you feel worse, and if that's ever the case, then stop, go see a professional. That's always the best plan of action. Solution number 3, clean your eyelids. Think of lid hygiene as skincare for your lids and lashes. Even if you remove your makeup really well, there's always some bacteria, flakes, and things called Demodex mites that can collect on the lash roots. And so this buildup, which we actually call anterior blepharitis, can really fall onto the surface of our eyes and make us uncomfortable. It kind of is when we say we wake up with crusty lashes, that's what anterior blepharitis is. Now, what works best? Gently cleaning along the lash root with a dedicated lid cleanser or wipe. And please, no baby shampoo. It's really harsh for the eye area, and now that we know better, we must do better. So we have 3 options actually of lid cleansers. The first are sprays. So the most common is hypochlorous acid, and it's one that we use all the time. It's a natural solution. It works really well to clean the lids and lashes, and you don't have to wash it off. And as a bonus, it really helps for skin conditions like rosacea. So a huge win-win. The second are lid wipes. These are great because you also have the actual physical towelette, which will remove the buildup, but the solution will also do what it has to do. I personally love the BlephAclean ones. They're the ones I drag around all day because they're non-preserved. They're super gentle. You could use them on babies 3 months and up, but they're very powerful. The third option is a foaming cleanser. Most brands will give you the option between a lid wipe and a foaming cleanser. So you would wash your hands really clean and then spray 2 pumps of foam onto your fingers and clean your eyelids and lashes with that. There's actually even lid cleansing brushes these days that are invented that are super cool and make it really quick and easy to clean your lashes. You could honestly think of it as a little toothbrush for your eyelids. It removes everything in those tricky spots that maybe the wipes or the fingers will miss. So those are a few of the options we have to clean our lashes. The most common question I'm asked is, which one of these is actually best? And my true answer is whichever one you'll do consistently and fits into your everyday routine. Because like anything in life, consistency is truly the key here. To sum up, number 1, use the right eye drop to support the underlying problem we have. 2, daily heat therapy and blinking exercises to melt and express the healthy oil and keep the good quality tears stuck to your eye. And 3, lid hygiene to keep bacteria, debris, and those little mites eat away. In my next video, I'll share surprising tweaks I bet you've never heard of that you can make around your house or your office that could actually improve your dry eye, or maybe things you've been doing subconsciously that might be hindering your dry eyes. If you found this helpful and you want to continue learning, I'd love for you to join us here by liking, subscribing, and ringing the bell so you don't miss the next video. Together, we'll build a supportive community and help more people feel good in their own eyes.